Okay, so my name is Daniel Lewis, and this is the final video, which is discontinuing an IV, a continuous IV to a saline lock, doing an IV slow push, and then discontinuing the IV in general. I'll do it in kind of three separate parts. So the first thing is verbalizing the six rights of administration, medication administration, which is right patient, right drug, right route, right time, right dose, and right documentation. So the first thing I'm going to do is discontinue this IV and do it to a saline lock. So before I do that, I'm going to go ahead and check the orders. In this case, the orders say to saline lock after second liter of normal saline. So patient's already had the 2 liters of saline. I'm going to go ahead and go knock on the patient's door. Knocking, introduce myself. I'm going to perform hand hygiene, wash my hands, and ask the patient to identify themselves with name and date of birth. Once I do that, I'm going to go ahead and clamp the IV tubing because it's finished. After I clamp it, I'm going to go ahead and assess the IV site, assess for any redness, swelling, coolness to the touch, anything like that. Since I don't do that or don't see anything, I'm going to go ahead and apply clean gloves. And okay, so the tubing is already clamped. So at this time, I'm going to go ahead and remove the tape that is holding the IV tubing down. Oh, the tape is stuck to my gloves. Come on, get off me. Okay, and I'm going to go ahead and secure this, and I'm going to go ahead and remove the tubing. And I would just hang that up or, flip it on the pole. And so I'm going to go ahead and open an alcohol wipe and clean the saline lock so I can flush it with saline. Alright, and I already have a 5 ml saline lock here, so I'm going to go ahead and flush with all 5 milliliters of saline. And at this point, I would put on a cap, the little antiseptic caps, the little green caps that they have to keep this sterile. Now that I have it saline locked, I would go ahead and explain the patient how to maintain a saline lock, making sure they're not pulling at it, hitting it, anything like that. The reason why we're doing it so that we can still continue to give medications if we need to. And then once I'm all done with this, I would, remove my gloves. I'm going to keep them on. Actually, no, I'm just going to take them off. Anyway, once I'm done with that, take off everything. I would, clean up my supplies, and then I would go document in the MAR that I discontinued the IV, did the patient education, all things like that. So now it's a little while after I went ahead and saline locked this IV. We get an order from the doctor. I'm just going to go ahead and read it. It says, give Dilaudid 2 milligrams IV slow push every 2 hours as needed for complaint of pain related to coughing. The actual Dilaudid label states Dilaudid 2 milligrams per milliliter and dilute with 2 milliliters normal saline for IV administration. And then the rate of administration is 1 milligram every 2 minutes per IV slow push. So again, I already verbalized the 6 rights of administration. I already verified that I do have the correct patient. I already got it ready. So in this case, it is again 2 milligrams per milliliter, and so the order is for 2 milligrams IV slow push. So I have 1 milliliter of my fake Dilaudid, and then I use 2 milliliters of normal saline. So total, I have 3 milliliters in this syringe here. I've already got everything ready. So what I'm going to go ahead and do is I go into the patient's room. I would wash my hands or do hand hygiene. I'm going to go ahead and apply clean gloves because I've already verified the patient, and I've done the 3 checks for the medication, make sure that it is the correct medication to be giving. So the first thing I need to do is I need to clean and flush the saline lock to make sure that it's still patent. So I'm going to go ahead and open up a alcohol wipe, and I'm going to go ahead and clean the saline lock port. And here I would have just a 5 ml saline flush, but I have a 10 ml, so instead of having 2 of them, I'm just going to do half now and half at the end. So I'm going to go ahead and connect this, and I'm going to go ahead and flush this. Reason I'm doing this is to make sure that the IV site is still patent. While I'm doing this flush, I want to make sure that there's no infiltration, redness, swelling, anything like that happening while I'm actually doing the flush. So nothing like that happened. Everything is still good. No swelling, no redness, no infiltration, phlebitis. So I went ahead and did that. Now that I have that flushed, I'm going to go ahead here again. I have a 3 ml 20 gauge needle, and I am going to go ahead and stick this in the port, and again I'm going to be administering it at 1 milligram per 2 minutes. Now I'm not actually going to do it that slow, but that's how slow I would be doing it if I was doing it to an actual patient. Had a brain fart there for a minute. So I'm going to go ahead and attach the syringe. And again, I would be doing this at a 1 milligram per 2 minutes time. And I would go ahead and put that in a sharps container. I would properly dispense of all my equipment, and then I would go ahead and go and document, well, I'd stay there and assess to make sure that there was no patient reactions, anything like that, for a few minutes. And then after that, I would go and document in the MAR and the nurse note patient's reactions, the medication I gave, date, time, all that kind of fun stuff, my name. All right, and I'm going to pause it, and then we're going to go ahead and do the last part, which is discontinuing an IV. So on that last part, I got a little messed up by the whole trying to do the medication. Anyway, after I would do the medication, I would go ahead and flush again with 5 milliliters of solution. So I'm going to go ahead and do that now. So go ahead, and I'm flushing again 5 milliliters of solution. Okay, and it is flushed. And now I would go and do the other thing, clean up all my stuff, go document in the MAR, everything like that. Alright, so for this last part, this is discontinuing the IV. So at this point, I've, patient's done, he's about to go home, he's going to be discharged. So again, I would go to the room, introduce myself, perform hand hygiene. For this, all I need is gloves, gauze, and tape. So I'm going to go ahead and put my gloves on. And now that I've done that, I'm going to go ahead and secure this and start to loosen the tape that is actually holding the IV catheter in place. And I'm going to secure it while I do that so it's not pulling on it. I can't get this tape. This tape. There we go. sticky. Alright, so I'm going to get that off my gloves. And I'm going to go ahead and peel the tape and everything off. And at this point, I'm going to have some gauze ready, and I'm going to go ahead and pull out the catheter, check it for intactness. While I'm doing that, I'm going to go ahead and apply pressure with this gauze. This catheter does look intact. I would put that in a sharps container because it would have the patient's blood, but I don't have a sharps container. So I'd go ahead and apply this pressure to this for a couple minutes. While I do that, I'm going to look for any signs of redness or anything around that, and I would apply some tape just to cover that up until it does quick bleeding. Again, that's the sterile dressing and the tape. And then I'm going to discard all of my equipment, my gloves, everything else, and I would go and document all the relevant information in the nursing note and the MAR. Thank you.